I'm Dr. Jenny Holman, board-certified dermatologist.
I'm Tori Burns, the physician assistant here at the Center for Aesthetic and Laser Medicine.
We are going to talk about one of our favorite treatments, something that we've done for years, microneedling, specifically skin pen microneedling. We utilize the first FDA-approved microneedling device, the skin pen, to see something called collagen induction therapy.
There is truly not one patient that I do not recommend microneedling to. I think it is fabulous, not just for my acne scarring patients, but for my women that want to see an improvement in their fine lines and wrinkles, large pore size, just their texture and overall tone. And I do treat myself at least once a month. So I really do believe in the power of microneedling, especially with the skin pen.
So what's the science behind microneedling? Well, like I said, collagen induction therapy. So you come in, we put some numbing on your face that sits for about 10 minutes because it's really not a painful procedure. And then we use this device, the skin pen, which has all these needles that create microchannels, thousands of microchannels into your skin. And then what happens with these tiny controlled micro injuries, as your body heals, everything tightens. You get this new collagen that's formed, and that's why you see the improvement in texture, tone, fine lines and wrinkles, and definitely in acne scarring as well. We see some great improvements in scars and stretch marks also.
We do treat that often. Microneedling treatments are definitely cumulative. So one treatment is great, 2 treatments is better, 3 treatments is even better, and you just can kind of build upon the collagen that you're creating. So we usually have patients come every about 2 months to have microneedling, and microneedling is also a great way to incorporate platelet-rich plasma.
So when you think about microneedling, you can also think about it as delivering a drug into the dermis of your skin. And so when I rub something on the surface of my skin, it kind of sits there. We have that upper layer of stratum corneum. With microneedling creating these channels, I can actually deliver the power of something down into the skin with a really low invasive procedure. So platelet-rich plasma is a great way. So essentially that microneedle is the aerator, and then we take your own stem cells, the fertilizer, drive that into your skin. It's fantastic for rejuvenation in a very, very natural way.
We've also found that the microneedling device is great for treating melasma. So just like Dr. Holman was talking about driving that drug into the skin, we use certain medications to really combat melasma, and we have seen amazing improvements.
We also microneedle Botox into the skin as well. It's fantastic for tightening pores, for oily skin, and for rosacea. It's one of my favorite treatments for rosacea because, again, very, very natural, but to decrease that flushing without having any of the typical kind of things that you think about with Botox affecting kind of muscle movement, but driving that into the skin really creates a glow and is fantastic for rosacea and other conditions.
Right. And as Dr. Holman touched on, we do use a numbing cream that is really powerful. So as you'll see, it is very comfortable. It is not a very uncomfortable procedure for our patients. There's no downtime. You are red maybe the next couple days, but besides that, I don't think there's really any downtime with microneedling.
There's not, which is one of the fantastic things about using the skin pen is that your cost of treatment is significantly lower than compared to laser treatments, but the effectiveness is definitely comparable and your downtime is minimal. Most of the time I tell folks they look like a hot mess for about 4 hours afterwards, but you're back out the next day, typically with makeup and maybe a little bit of swelling, but it's not something that socially is really gonna impact you like a lot of my laser treatments that I perform.
And 3 days later, you get this beautiful microneedling glow. I don't know what's happening. The collagen is starting to kick in, and you just get this glowy skin, this dewy skin, and it's absolutely beautiful. So I love microneedling.
There's no limit on microneedling either. I get that talk like, how many times do I have to do this? How long is it going to last? You don't have to stop inducing your own collagen. You don't have to stop telling your body to tighten things up through there. Microneedling is something that can be done, and looking at the FDA studies, as often as every 30 days if it's something that works for you and you find that this is what is really helping you rejuvenate. So if you're someone who suffers with acne scarring, if you're someone who's interested in rejuvenating, seeing an improvement in fine lines and wrinkling, especially in texture and tone of your skin, come in and see if microneedling is right for you.
It definitely is right for you.